DeBakey Cardiovascular Education Studios at Houston Methodist Hospital. I'm Arvind Bhimaraj. I'm the Interim Division Chief of the Heart Failure Section here at the DeBakey Heart and Vascular Center. And it's my honor for hosting Dr. Drakos, who's here with us from Utah, who's made the trip here and enlightened us in his wonderful grand rounds on the concepts of cardiac recovery. So Stavros, thank you for coming.
Thank you for the invitation. The honor is mine to be here at your historic institution.
Thank you very much. And you really captured the paradigm of cardiac recovery as a window into helping patients not just getting an LVAD, but opening up to the enormous population of patients who have heart failure and trying to recover them. And as we're opening up for the audience to send in questions, I want to start off by asking you something more in your personal realm of you've worked with one of the giants in cardiac recovery, that is Sir Jakub. Do you recollect of any memories that really impinged on you, how they have instilled your interest in cardiac recovery?
Absolutely, yes. And given that, actually that's a great way to start this interview at a historic place where Michael DeBakey thrived and shined. Given that these giants, that they contributed so much on the progress that we had in cardiovascular disease over the last half century, looking at the work they've done is always inspiring. And so I had the privilege and the honor to be mentored by Sir Michael DeBakey. And as you said, it really, when you have these experiences, it really shows, you need to know where you come from to help identify where you want to go. And I would say that this has been a life-changing experience, being mentored by people like Sir Michael DeBakey. As I'm sure many people in this institution here can say similar things about the mentorship they receive from DeBakey and other important figures in cardiovascular disease. You're asking me about events, and we were talking earlier, Arvind, about how important is the clinical mission and how, in order to build a clinical center of excellence, how important is to have the academic mission, training and research. And I was around here and I saw the amazing facilities, and you're asking about events that happened with DeBakey. I will never forget that once we did a case with an LVAD patient, and it went one of the first cases, and I was a cardiologist helping in the OR very late, and after going back again with bleeding and all these things, and then back and forth in the ICU, we were all very tired. I remember when the patient came out after the third time we came out of the OR, we were sitting there and we were sleepy after 20 hours almost up. And he was, I remember him very tired, going like, you know how you want to go to sleep. And then there was an abstract of something we were writing on the table. So this excellent clinician, he looks at that and then he wakes up immediately. And I was sleepy as well, and he begins talking to me about what are we going to do that and these. And so you see how clinical and research come together, and these important people, how much they value innovation and working to improve what we do and how we learn more. So I will never forget how he got energized and reinvigorated immediately when he was ready to tired to go to sleep, when he saw this sitting on the table, and we had started a discussion again for an hour or so. So that's, I think, one of the moments I would like to share with your viewers.
No, thank you. And I think standing on the shoulders of giants is really the motto that all of us who had the luxury of institutions which have these giants really is inspiring, and I appreciate you sharing that story. So let's get to the questions that are being posted, and I want to remind individuals who are watching the live stream that you can text in your questions, just follow the instructions on the screen. The first question we have here is, how do you engage patients in order to gather data on patient-reported outcomes? And it's related to the talk that you gave this morning.
Yeah, that's a great question. As you may recall in the talk, the Grand Rounds talk earlier this morning, we showed when we showed the whole team and the collaborators, I said it boils down to know what the doctors think, and the nurses and the healthcare professionals, but what the patients think as well. And this field now of patient-reported outcomes is gaining momentum, and we are happy and glad that we are in the forefront of that field at the University of Utah. And the question is, how do we engage patients? I would say, how do you engage physicians is even more important, to take in consideration what the patients do. But the question is about the patients, and I think what we do, and that's the way you should do it, whenever you see the patients, you should make it easy for them. In our institution, we have iPads sitting in the clinic while they're waiting for their appointment, and they just report their outcomes before the clinic appointment, and it's a very quick thing, and then this goes in the electronic medical chart, and by the time they come to be seen in clinic, we already have what the patients reported a few minutes before you see them, and you measure their vitals and everything else. So that's how you engage it. You make it easy for them. And who is the patient that you will tell while he or she is going to be seen, please tell us what you think about how you are doing, and report it in a structured way, and we will make out of these numbers and statistics that can help us understand better what's going on. The patients, if you make it easy for them, they will be engaged. Of course, how can you reach home? There's other ways now with the era that we are to engage patients even from home, to do this by reaching out with social media or with even phone calls sometimes. There are many ways to do that.
And you mentioned a little about your work where you're gathering patient outcomes in the clinic, and I think your institution has done a phenomenal work on that. Can you share a little on the specifics of what you're doing with that initiative, and what are the information you're gathering in the patients?
We use the PROMIS, which is the patient-reported outcome score, and we use this approach in the clinic. We have already set up the infrastructure, so the patients, when they go to register, they get an iPad, they sit there, they report everything. Just takes a few minutes, and then everything that they report goes directly in the EMR under their chart, and it compares with what they reported in their prior visit and before that even, and then you can see the trends. And then when you see the patient, you know how we always try to interrogate the patients, and we don't have the time sometimes to ask. So this is going through all of these questions there, so you get in a structured way the answers, and it helps you also during the interview to go even deeper and clarify a few of the answers that you see there. So that's a great way to get the visit with the patient to be even more meaningful, and what we say now, patient-centered.
Yeah, no, that's a phenomenal work that I think your center is doing, and hopefully we'll learn more on the implementation as your center shares the experience. And I think there's another question related to patients, which someone's asking about your symposium in January. And for other listeners, Utah Dr. Drakos actually runs a conference called UCARS, which is about cardiac recovery. And the question is, do you involve patients in this conference, and if so, how are you involved?
That's a great question. So one of the deficiencies we have in the first few conferences, and the ones that you attended, the first couple, Arvind, didn't have that. So that was one of the major deficiencies. And as we move forward in this era of engaging patients with patient-reported outcomes, 2 years ago, the planning committee were sitting there, and we go like, hey guys, we don't have patients in the symposium participate. They come and listen, but how about being part of the faculty? And actually now, we did it the last 2 years, and it was a phenomenal success. It was the most, this breakout session that we did with live patient participation, learning from them, it was one of the most popular. So we've done it again, and now it's going to be the third consecutive year that we will have patients part of the faculty, and they will come there and they will teach us, right? Because we need to learn from them. And that's one of the major, I think, improvements we've done. When you do something over the years, then you improve it. That's, I would say, probably the most important improvement we've done over the years is the patient engagement in our Utah Cardiac Recovery Symposium, which happens always in January before the Martin Luther King weekend. And this year is going to be, again, Thursday, Friday, January 16th and 17th. And anybody is welcome, of course, to come, present, talk, and maybe even your patients can come participate. Why not?
And I think you bring up a very good point, and whoever is asking the question, open that discussion that we're talking a lot about multidisciplinary team to battle a disease, and often we forget that one of the disciplines in that team should be patients, and engaging them, learning from them really becomes important, and also empowering them. So I think I'm really glad the field of heart failure is going towards that. We do a patient conference for a day conference on heart failure, where they come and learn about how to cope, how to live with heart failure, because these are things that, as you mentioned, we don't have time in a clinic visit to accomplish. So I'm looking forward to your symposium and what you can shed from the patient's perspective. The other question is, I think the field of recovery has been very exciting. As much as it is exciting, there's still a lot more to achieve, which I'm sure you'll share. The question that's being posed is, what does success look like to you with myocardial recovery in the next 5 to 10 years? And I'm guessing the intent is, how do you define a successful recovery?
Yeah. So I think this question is critical. I would, for the people joining us that they were not able to hear the Grand Rounds presentation, and I think the picture of the iceberg that we showed at the end summarizes what success looked like. We have the tip of the iceberg, that are the patients undergoing mechanical circulatory support, these more percentage of advanced heart failure patients that by improving their heart function and structure, meaning how the heart squeezes and getting it smaller from super dilated, is what success will look like, and then take the pump out and leave the patient with her or his native heart for a long time. This would be the success, and this is the tip of the iceberg, as we said. It's important for these patients, but even more important for this field is to use the myocardial heart tissue that we receive from these patients during these surgeries, in their blood, in their outcomes, and then begin understanding how the heart recovers. And then when we understand this, we bring it also in the lab, and we prove that this is how the biology works. Then the bottom of the iceberg, the real impact of this field, is to go then impact the whole field of heart failure, and not just these more percent. You use them as a vehicle, as a research vehicle. You help them, but they also help the whole field advance. And then by understanding how the heart gets better, then you can identify the targets that they will make us produce the new pills, the new drugs for improving the heart. And then we can go to a broader heart failure population, which, as we know, Arvind, if you go anytime at our ERs, this is the number one reason for hospital admission and readmissions. It's breaking the bank. It's a heart failure global epidemic. So if we have a way to use this myocardial recovery field to identify new targets with this research, to impact the whole heart failure field, this is what success will look like. And this is what we've been working. It's going to be a long journey, and we, as you know, have been publishing our findings, and others from other centers all over the world, either collaborating with us or independently. And you guys also have a great program looking into this, and that's one of the reasons I'm so happy to be here today, and we've been learning from each other. So I think that the success will be looking like what we just discussed. The tip of the iceberg, focus on these patients, and the bottom, which is going to be advancing the whole field of heart failure therapeutics.
No, it's a great task and a great journey to look forward to. And for those of you who are joining us just now, welcome to the Livestream interview and discussion with our Grand Round speaker, Dr. Drakos from the University of Utah. He's the co-chief of the Advanced Heart Failure Division, and also the director of cardiovascular research, and had just given a phenomenal lecture. Please look for instructions to text your questions, and this is your opportunity to investigate a great mind here with us. That actually leads into our next question that's shown up about heart failure prevention. And I think to kind of summarize that question, when we talk about recovery, we're talking about recovering a heart from a failed situation. But how do you take this to a concept of because I've always envisioned a a heart failure preventive institute, because opportunities that you can induce on not just incident heart failure, but if you get an MI, how do you avoid heart failure? How do you avoid heart failure when you get chemotherapy? So how do you see your work in recovery translate into preventing heart failure, maybe to the point of you and I lose our jobs?
Yeah, no, that's great questions, and I'm glad that the questions coming in the screen there from our audience are very insightful and forward-looking. Of course, and that's when I was talking about the bottom of the iceberg, heart failure therapeutics, some of these things that we will find, we will put also into the preventive arm. Because when you see how you can improve and recover the heart, some of these clues that you will get there, it's inevitable that they will lead you also to one step before. So if this goes bad or starts going back, or you see some signs that something that you find in the biology, and I talked about the T-tubules and the heart tissue research that we're doing at the molecular level. If you see something there, and as you saw in the Grand Rounds presentation, we are seeing specific things, then what would be the impact? Would be that you can test these later and use these to prevent the heart failure from coming. As you know, we changed the classification of heart failure more than now 10 years ago to focus on prevention. And we talk about things that they are not considered by most of us, they were not considered heart failure, a stage 1 of heart failure now. So I think that this research, and that's why we encourage patients and our colleagues to focus in this field, will definitely have an impact of preventing heart failure, and we are already seeing the first signs of this.
No, I think that's actually the final gold mine of curing heart failure, and hopefully the future will look bright based on all the work that you're doing and we're learning. I think you mentioned a very important paradigm about the biology of heart failure. We've evolved, and I really like that you've shown that we've evolved from a mission to replace an organ to trying to understand more of biology to tweak them. So I think the question that's coming in is, I think that I'm sure audience perceive that it's a fascinating concept. What they're asking is, if you were asked to propose a collaboration in this regard between clinicians, researchers of natural science, professional organization, and industry, what would this look like? And I'm going to give you a scenario, because we've built an industry of supplanting the heart with machines. Now you're redirecting the industry, saying, forget the devices, let's try and go back and try to re-revise the heart. How does this future look? And I think that's a very insightful question.
Oh yeah, I'm glad about this question. So as we mentioned earlier, a couple of years ago, NIH gathered, and I had the honor and the privilege to co-chair this working group on myocardial recovery and using this science and this research we're doing to advance this field. And we got there exactly what our friend who asked this question said. We got in the room and we locked them for a couple of days, as I said, in Bethesda at the NIH headquarters. All of the people that our viewer is asking, clinicians, researchers, basic translational and clinical researchers, professional organizations and industry were there as well, participating actively. The only thing we didn't get in this working group, and we need to get it the next time, was patients in the same room as well. We were still in the old way we were doing things. Patients were not with us, that working group, but next time we will make sure we include them as well. And so what we tried to brainstorm during that meeting was, how should we foster this collaboration? And what came out from that, and now we are organizing trials and registries, and we are organizing ways to move forward by engaging all these players. So the conclusions from this working group are on the NHLBI website, and we also publish these in journals covering all these disciplines, from bioengineering to basic science to cardiology to heart surgery. All concomitantly, simultaneously publish the conclusions of this working group, which is exactly, we address there what the viewer is asking, and we are proposing specific steps in order to advance the field. As you know, things don't happen overnight. You need to be focused, committed, and sometimes investment needs to take place as well. So we would love to see, and we are seeing already, the NIH investing more, our institution investing more, and of course grateful patients or other organizations should and could help more by contributing to these efforts. And I would say that by doing that, this collaboration that the viewer mentioned will become even more meaningful. And you know how they can participate in our board meetings, and actually the contributors can influence where things are going with their ideas. We don't pretend that we know everything, so that's why you need a lot of people in the room and ways to get all these ideas and thoughts and put them forward in a structured and systematic way. And that's what this working group is doing, and we would love to get more support from anybody who is interested to join.
And you brought up a very important point in all these discussions about the biology of heart failure. And I want to acknowledge that when we talk about heart failure, as much as we show so much technological advancements, we don't understand the biology of heart failure. And the work that you've done and our mission in our lab is to really have a way to say, when a young person's heart fails, instead of calling it idiopathic and not knowing what the reason is, I wish we can have a genetic signature. I wish we can say that this is the way you will respond and have some personalized approach to it. So again, we commend on the work that you're doing, and we look forward for a lot of collaborations for the future in this regard of discovering the biology, and hopefully very beautifully put by you to modulate the natural biology to help prevent the disease, not look at the bad pathways and block them, but it's time to discover the good pathways and promote them.
And one of the things we mentioned earlier, Arvind, I think this is a crucial point, is how we can learn from other fields as well. So we talked about the National Cancer Institute and the fact that the oncologists are so far ahead of us in doing exactly what you said, preventing. We all know that Angelina Jolie got mastectomies because of the research that was done, suggesting that she had a high likelihood to get cancer. So without having the disease, she did a preemptive measure, and that reached out the public, and people were shocked. And we need to go there. We need to go there, and this is a way for us to go there. It's an unprecedented opportunity for our field, because the cancer people always got the culprit tissue because we removed the tumors. But it was not easy for us when people were coming for heart attacks to ask them to give us a piece from their heart. Now we have a tool here that, because of the standard of care procedures, we get some pieces from these hearts for things that we need to do anyway. So they don't need to donate it to research, it's going to go in the trash can. That's why all of these people that we enroll in our studies, they are very happy to participate. It's going into research instead of going into the trash can, things that we remove during these procedures. So now we have the hope, and that's one of the things we mentioned in the working group, that we can go where the cancer people are going already ahead of us and use this information in order to direct our patients towards prevention and understanding how to treat them better. You said about the heterogeneity of the disease. We have all these etiologies that they lead to a bad heart. And it's not the same, right? We call idiopathic. Right there, idiopathic, meaning we don't know what's causing it, and this is almost half of our patients. So there's a lot of things we can learn. And we think that by collaborating and by getting the information from the heart tissue and blood and the clinical information we get from how the patient is doing in their outcomes, we can reach there and begin understanding better how this heterogeneous group of people, who, as we said now, is a global epidemic, how we're going to treat that to begin with and prevent it later.
Thank you. Thank you for all your insightful answers, and I thank all the live audience for their very thoughtful questions. In fact, I learned a lot from these discussions. I want to remind everybody that this is a weekly event of Grand Rounds on the Methodist DeBakey Heart and Vascular Center educational website, with close one-on-one ability for you to ask questions of great minds that come here. I want to thank our guest today, Dr. Drakos, for taking the time and
enlightening all of us. Thank you.
It was my pleasure. Thank you so much.
Pleasure.